Hi, this is Troy with Aero Performance and Physical Therapy, here today to talk to you about elbow injuries, how to determine if it's a golfer's elbow, tennis elbow, or something else. And one thing we see in the clinic a lot is tennis elbow. We see it with racket sports, we see it with someone doing a weekend project, maybe doing a lot of hammering and gripping activities. And that's pain on the outside here. It can be in numerous different locations, and that's because we have numerous different muscles that have a small tendon that attach to this bone up here. The muscle belly is pretty thick on most people, and then it narrows down into a small tendon, and that's why we have these injuries, is because that tendon is so tiny, it can develop little tears if you overuse it. Maybe you play a little bit longer of tennis that day. Maybe you're going to a tennis camp. We see that a lot. People will go to a tennis camp, come back, and they've been playing tennis for 8 hours a day for a whole weekend. And that obviously just needs some recovery time. Let that tendon heal up. Tennis injuries or tennis elbow is also linked to a lot of caffeine intake that reduces the blood flow to those tendons. Smoking or nicotine can narrow the blood vessels to those tendons. And then also being a female, you just have smaller tendon over here, and it leads to just a little bit more small tears. The other side of the arm is kind of the golfer's elbow side, kind of a loose term because we see it a lot in pitchers as well. The pitching motion is the fastest human motion recorded, which can be upwards of 21 rotations of your arm going around per second if you take that speed and disperse it like that. Now, one thing you need to remember is that after you pitch and you have soreness here, you need to ice it right away, maybe for a day, and then also ice the shoulder. But you also need to think about your shoulder mechanics. Are you keeping that elbow higher than the shoulder or at the shoulder level? As soon as that elbow drops and you're throwing like this, it will increase the torque on that elbow, putting you at risk. It can also strike with golfers, maybe that are doing too much too soon. And so make sure when you return to golfing, you don't just rush into it and do maybe 3 18-hole courses on one big weekend. But make sure you're stretching after you do your golfing. Doing different stretches like this, keeping that elbow straight, can really help you maintain a healthy muscle mass there. That should be all. Hopefully that helps. Take care.